Hey everybody, how's it going? Dan Shinder here with Janice Ying on Drum Talk TV for Drumming Injury Talk. And if you play drums a lot, you probably have some repetitive motion injuries or pretty much any other instrument for that matter, right, Janice?
That's right. Yeah. I mean, it's not just overuse, but we text all day, we sit all day, we're in front of a computer all day, so
Yeah,
the whole gamut of things.
absolutely. So folks, go ahead and chime in. You're welcome to ask questions. I'll make up some answers and then Janice will correct me. Just kidding. Janice is a physical therapist. You can see all our info in the post, no matter where you're watching this. As we're broadcasting, we're live on Facebook and YouTube. And then we put the archives also on Instagram and Vimeo. So if you have repetitive motion injuries or you're not sure what they are, look at the description of the post. It could be tendonitis, carpal tunnel, bursitis, which I have to bring up in a moment, and many
Can't
other
wait.
things. Yeah, but the first thing I'm going to bring up actually is something that my drum student Marty Shank asked me about last night, and he's young, so it's not necessarily a older person's injury, but he was telling me that he was practicing the other day and his left index finger locked up. Uh,
Mm.
now I think this was before you and I started doing the show, and it's when Dr. Nadia was doing the show with me, but I had both my ring fingers kept doing that. And I went
Huh.
to the doctor, and the way I explained it to Marty, and I know you'll do a better job, is they said, well, if I remember right, because I had it, you're developing a nodule or nodules on your tendons of that finger, and he wasn't sure what a nodule was. So then I wasn't sure if I was describing it correctly. So I'll hand it to you. Why don't you take it from there?
So I think what you are talking about is something called trigger finger. Is that?
Yeah.
Yeah, so trigger finger is one of those conditions that can happen in anyone really, and I think, if I'm not mistaken, it usually happens more in males versus females.
Oh, really? I didn't know that.
Yeah, yeah, but I've definitely seen it in both. So like don't take it as like women don't ever get it. But
Yeah.
basically it's a condition that can happen in your hands predominantly, where so you have a lot of like ligaments in your hands that connect all the bones to each other, but you also have certain tissues called pulleys that are kind of along your fingers. So you have a pulley here, you have a pulley here, you have a pulley here. And what those tissues do is it keeps the tendon close to the finger, so it helps you be able to grip efficiently. That's basically their role. And so as we move our hands, the tendon kind of slides back and forth, nice and smooth. But sometimes there could be a little nodule. So like think the way I like to describe it to people is like think if someone had like tied a knot in a
Yeah.
string or in like a garden hose and you're trying to like move the garden hose across your garden, but it gets stuck under something and you're like
Right.
pulling, you pull hard enough and like all of a sudden it like kind of lets go and like you have more movement.
Yeah.
That's kind of what's happening in the trigger finger where it's happening underneath this specific pulley here or whatever finger it's happening in.
Yeah.
It's usually in this area that the nodule will kind of slide underneath the pulley, but then when you're trying to open your hand, it kind of gets stuck
Yeah.
until it kind of crosses the other side of the pulley again. So that's what's causing the triggering. And so oftentimes what people will experience is like, you close your hand fine, but then you open and then like one finger would get stuck and
Yeah.
then it all of a sudden will like snap open or like some people will have to like kind of
I had
force
to.
it open in like kind of
Yeah.
more severe cases. Um
And it was
yeah,
painful for
so
me too.
it
Eh,
can be. It's not always painful, like, usually in
Right.
the earlier stages, like, it's not initially painful, you just kind of feel this weird, like, kinda bump as you're, like, trying to open your hand, but then as if the nodule is big enough, it's gonna get stuck. It's a lot harder to get it unstuck, and so that could be painful or it could like, generate inflammation, etcetera.
Could it happen? Is that a repetitive motion injury? Is it some sort of vitamin or mineral deficiency? What does it cause from?
From my understanding, it's more of an overuse type injury, but
Ok
there are other conditions where it just kind of like develops on its own, right? It could be something like completely unrelated to overuse. So I do see it with people who have overuse, but then also some people just develop it on their own, even if they're not using that particular finger over and over and over again.
so that explains my case overuse since it was my middle finger. No, no, actually actually, it was both my ring fingers, which also kind of explains it in a way, but it
Yeah.
went away, and, do I have them handy or are they in my studio? They went away because I started wearing, my Metaflex therapy gloves, and
Oh
with the
yeah,
Metaflex
sure.
therapy glove, you can adjust the tension. I think mine are in my studio, I don't see them. I should have brought them up here to demonstrate, but
I think
th
I have
I
mine over here. Here, hang
do you
on.
have yours there?
This one right here, right?
Yeah, yeah,
Yeah.
I wore those for, like, maybe a couple months, not while I was playing, but when the fingers started acting up on either hand, and it was both of them, I'd
Yeah,
wear it
so
for a while,
you
and
kinda
after a
would just,
while,
like,
it just stopped getting
tense up
stuck, it went
the
away.
Yeah, so, I mean, there's a lot of
Yeah,
different treatments. Kind of what we would do in the clinic is, we would put basically, it's like a ring, but then on the front on the palm side of the hand, there would be, like a little bar, to kind of prevent you from flexing that joint too much. And so the hope of that is that, if you don't use that motion as much, the inflammation will die down and hopefully that nodule will like get smaller too, and then eventually you won't need that anymore. So it's kind
and
of you
is
kind of
this something
splint
all
it. I'm
okay,
sorry?
and it's not something that ice therapy will help with, right?
No, I mean, it would probably not. Ice therapy would probably help kind of temporarily, but this is more of
Yeah.
like if you were to put wear a wrist splint, if you had like carpal tunnel or like you
Oh,
sprained your
yeah,
wrist, it would actually like immobilize that area or prevent you from moving too far through that range of motion.
great.
So
So, if
yeah,
anyone has that or any other repetitive motion injuries, especially if you believe it might be from playing your instrument, whether it's drums or otherwise, go ahead and chime in with a question. I'm the next patient. Uh, my bursitis in this elbow has really flared up lately. Now, thankfully, it doesn't appear to have really swelled up. When this happened about 30 years ago ish, 28 years ago, it swelled up the size of like a tangerine, and I thought I got
oh
bit by a
yeah,
poisonous spider. It hasn't done that, but I could tell that that's what it is because of where it is. It's a burning pain. And of course, just as it was starting to seem to subside, I built this new irrigation system in my garden and the constant movement and,
yeah.
all of that, I could not even, like, set my arm down or sleep on that side, it
Oh
became
yeah,
so
I believe it.
sensitive. So I
Yeah.
remember from our first conversation about this, and I looked it up to kind of explain it to Enjo, my wife, that the bursa sacs basically, they get inflamed, and that's what itis means, right? It means inflamed, swollen,
Yeah.
basically.
Yeah.
But I don't remember if there's a cure other than just resting it. And I think that's when I looked it up, that's what it said, something like rest it for 2 weeks or a month. I'm like, I can't rest my arm for that long. Like,
Right.
so what do you do? Do you just not be as vigorous with it? And for a drummer, what would one do if they're a gigging
Yeah.
drummer?
That's a great question because I see this a lot and like oftentimes so just to kind of recap what you already know is like bursa. So you have bursa, which are like kind of like fluid filled sacs. I would think about it almost like if you like filled up a water balloon, like but just like barely with just a tiny bit of water and you tied it up and it's like a very squishy and malleable.
Yeah,
And bursa are supposed to serve as kind of like little shock absorber cushions
right.
throughout different stress points in your body. So you have them all around your joints. You even have them around areas where like some tendons assert into the bone. because that could be high points of pressure too. So
Mhm.
sometimes you'll see that in conjunction with like tennis elbow or golfer's elbow, because you have kind of bursa around that area. And the elbow is a really unique place because a lot of people will, kind of subconsciously how they end up sitting or how they end up like working on the computer, they might put pressure on their elbow. They might lean their elbows on the desk or on their chairs, or if you're driving a lot. I've seen a case of like bursitis where
Oh,
someone's like leaning
so
their elbow on the
yeah.
windowsill and like driving across hour doing a road trip or
So
something like
even
that.
just from pressure.
Yeah, so the bursa can get inflamed in a lot of ways. So it could be overused where you're doing like some kind of repetitive motion, right? But it could also just be from like sustained pressure or just like the amount of pressure that you're putting through that bursa could get inflamed. And then when we have inflammation, we have more fluid buildup in that area, just as like the byproduct of inflammation, the inflammatory process. And so that's how bursitis can come to be. Pretty common areas would be like the elbow, like we're talking about, or even like the hip, the side of the hip. That's
Oh,
another really common place where people
that
will get
makes
it.
sense. I'm sitting a lot.
Yeah, sitting a lot, but or like crossing your leg, or you lay down in bed on either side.
Mm.
Um, and then your knees are another place where like you could get bursitis quite often.
Interesting.
Um,
In my case, I know, as I mentioned, how it got aggravated because of the
yeah,
work I did, but I
yeah,
don't know what caused it in the beginning because I'm really not playing overly too much,
sure,
and I
sure.
don't have room on my desk to sit like that. I really don't know what's aggravating it to begin with. It's kind of
Yeah,
a
so,
weird thing.
I mean, if there's not swelling, I mean, it could very much be bursitis, but another thing that's in that same area that you're pointing to, and I'm not saying that this is what it is, but just kind of like thinking about potential things that it could be maybe like even your nerve. So your funny bone, your
Mm.
ulnar nerve sits right
Yeah.
in that groove. Um, do you know why it's called the funny bone? I don't know
Uh,
if we've
I
gone through
I
this before.
I think it's because and I don't know if I ever told you about my accident with my right side, I'll tell that in a minute,
No.
but I think I'll tell you, it's a crazy, funny sort of
Oof,
story. It's funny now because I survived,
you're
but
right. It probably
yeah, I
wasn't
think it's a
funny at the
funny
time.
bone because of that numbness, that electrical shock you get. Is that why it's called that?
I mean, does that feel funny to you?
No,
Not a
but it's
fun
funny when it
experience.
happens to someone else. No,
That's true. No,
no, why is
actually,
it
this
called
is
that?
it. So, do you know what this bone is called in your arm?
That's the ulna, right?
No,
No,
the
this
ulna's here.
yeah.
This is called the humerus.
Humorous, that's right.
And so that's why it's called the funny bone is because it sits
Oh,
behind the
good
humerus.
grief. Well, what
I know,
happened to me
anatomy
is
nerds.
I did something really dumb. So, I was a teenager, I was 18, still living at home, and, my I long story short, I had a really bad headache from something that went on the night before, and my sister's bedroom was above the kitchen, and my
Okay.
parents were away, and she kept I don't know, she had a friend spend the night, and they were jumping and just the thunderous sound, and they kept saying, stop it," and I got mad, and I jumped up to swat the ceiling, and I had a double whammy. My hand went through the ceiling, and when I came down, my ulnar
Ouch.
nerve came right down on the burner grid of a stovetop.
Ouch. Oh
Yeah,
my
like,
gosh.
bam! And that really made me mad, and I thought I chipped a bone in my elbow, but I did not. I kept that a secret for at least 25 years. My parents thought that I was swatting at a wasp in the house or something, and I finally came clean and told them what really happened because they came home and there was a hole in the ceiling. But this is very sensitive. It's, kind of amazing that I
Sure.
have the bursitis on the opposite elbow because this is
Yeah.
consequently extremely sensitive. If it's too windy and it blows on it, it's like
Oh,
bzzz,
no
like,
way.
it's so
Wow.
sensitive. Yeah, even many,
Yeah.
many years later, again, I had to be I had probably 18 and I'm 61 now. So that was a while ago and I still feel the effects. So much
Oh my
so it's on
gosh.
the other side of the body.
Yeah, right. It kind of traversed. But yeah, so like, if it's not the ulnar nerve and it is purely bursitis, one thing that you could try, um, so uh, this area on the inside of the elbow is where all the muscles that flex your fingers, so curl your fingers up, that's where all those muscles attach onto. And
Yeah.
so that's synonymous with golfer's elbow is kind of like the common term that people hear about it, whereas tennis elbow is on the outside of the elbow, golfer's
Ah,
elbow is on the inside. Um,
okay.
yeah, so if it is something like overuse tendonitis related, and it's also bursitis, something that you could do is you've seen those like straps that people wear around their arms
Yeah, like a
that kind of go
compression.
yeah, and
Yeah.
so, do you so the role of that strap actually so if people have bursitis, that's related to tendonitis of those muscles, you potentially could wear that strap, and the
Okay.
idea behind the strap is and a lot of people don't really know, they just see it a lot of other people wearing it, so they put it around their arm and it feels better, right? So, which is great, but
If that's
the
not a
true
microcosm of human behavior, I don't know what
right.
is. Well, everyone else is
Right.
doing it, so, oh,
Yeah, I
wrong
saw
arm.
my friend do it, like, I'm just gonna do it too. Yeah, so the idea behind it is because, like I said, that's where the tendon and attaches to the bone, and so there's a lot of force that's being transmitted through that single point in the bone, and so by putting that brace around, you're actually changing the insertion site of where that tendon is,
Ah,
or you're not changing it, but you're kind of displacing it temporarily
yeah,
while that area heals.
that makes
So
that's
that's the
interesting.
whole point of those like, kind of like bands, those arm bands that you see people wearing, and I know a lot of drummers who wear that because they deal with tendonitis a lot.
I
Um,
never knew that
but
that's what that was.
yeah, that's the point of, that's why it works, or that's why
Yeah,
it can work is, because it just shifts where the load is being transmitted through that tissue.
interesting. And for those
Yeah,
who don't know, the and or maybe you tuned in late, Janice is not just a physical therapist, but she works her main body of patients are musicians. So she sees a lot of
yeah,
different injuries from repetitive motion. And again, the list is in the post, but it's could be related to or actually be bursitis, tendonitis, carpal tunnel,
mhm,
arthritis, um, uh, pain in the arches, the shoulders, the hips, sciatica.
yeah.
I've had almost all of these. Geez, for different reasons, I think. So, folks, don't be shy. Chime in and ask questions. You've got Janice right here to answer them. But have you seen anything new or different or extreme recently in any of your patients that you can relay that might also help people learn from it on how to avoid it or see signs of an injury they have that they don't realize might be more serious if they leave it alone than if they give it some attention?
Yeah, I don't know if we talked about this last time, but I saw a couple of cases coincidentally, and this is not necessarily something common that I see per se, but I had a couple of cases back to back, like kind of within a couple weeks of each other, where the musicians had practiced so much that like they couldn't open their hands, like their muscles had gotten
Oh,
so
god.
tight
What
that like
instruments were they playing?
they were different instruments too,
Wow,
and like yeah, it was kind of bizarre. Like
that's
I
a
had
lot of
I
work.
I had seen it before, but I had never seen, like, multiple cases around the same time, so, I mean, maybe it was because of the end of the school year or something, like or performance season, but, I don't know, but,
Maybe
they were both
testing for a chair in concert band or
yeah, like
orchestra, and they just
auditions
overdid
and
it?
stuff. Yeah.
Yeah.
So like, yeah, it was just seemed to be a busy time, but like one person it kind of came on suddenly, another person had been going on for like a year. Like they had let it go a whole year before they came to see me.
Wow,
And I
and
was like,
kept
man, I
playing
can't
while
eat
they had the
and kept
condition, right?
playing and
Yeah.
right, yeah, totally. And so it's just one of those things that, so when muscles work, they only shorten, they only contract. There's there's a muscle contraction where you're lengthening, but really the muscle's still contracting, but controlling how slowly you like kind of release it back into that stretch position, if that makes sense.
Yeah.
So if you don't stretch your muscles out of those positions, let's say that you use you're a drummer and you use your wrist muscles, your both sides, your wrist flexors and your extenders over and over and over again, which is why we see a lot of like golfers and tennis elbows a lot, right? But um, um, whenever you're using those muscles, they're shortening, and so unless you're doing stuff to kind of stretch out of that position, it could potentially just get tighter and tighter and tighter because you're not asking your body to get out of those positions.
Right.
So your body's really smart and then also really dumb at the same time, where it can actually adapt to whatever your brain or what you're asking your body to do. So, if you're sitting all day in front of a computer working, or sitting in front of a drum kit for hours a day, playing, your body is going to be like, well, I don't need to be flexible in my hips because I'm just sitting all day. So I need to be in this position and be able to be functional in this position. And I don't spend as much time standing up. And so the muscles in the front of your hips might get really tight, which then could lead to back pain and etc. So same thing with your arms. Like if you're doing this stuff all day or you're doing this stuff all day and you're doing that hours on end, but you're not doing much else to kind of get out of those positions, your body will just be like, okay, well, this is where I need to live. This is where I'm spending the most time in. So I'm just going to be really efficient in this area, in this range of
Interesting.
motion.
And
Yeah.
people have to remember that pain is a signal for the body that there's something wrong. If your feet hurt, it's probably not the best time to go walking on nails, right? I mean, you wanna not keep working through the pain, and I know
I
some
mean,
people
I
have
wouldn't
to work
walk on
through
nails to
pain, but
begin with, but
yeah, right.
yeah. Yeah, pain is just a warning sign to alert your brain. It's like, "Hey, maybe pay attention to this." It doesn't necessarily mean that something is injured, but the potential of some kind of s
Susceptibility, right?
yeah, is kind of like that warning sign, right? And then it's up to your brain and you and your brain to decide whether or not that feeling or that whatever is causing the pain is going to be harmful or not. So the classic example is, since you were talking about landing on a hot burner, right?
Yeah.
So if you like, touching something really hot is a reaction, it's a reflex, right? Your body's going to kind of remove itself from the situation before you even register kind of like what it is that you're touching, right? But imagine if you've been like microwaving something really hot, right, for a long time, and you've been microwaving something and you know that that container or that plate or is going to be really hot, but you still grab it and you're like, ow, 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 and you move it to
You've
like
been to my house.
where wherever you're gonna like put it.
Right.
So your brain is kind of overriding that pain signal because you know that for this moment in time, because I'm only going to go from point A to point B, that it's not going to burn my finger, it's not going to damage the tissues in my finger. Whereas if you didn't see something and it felt that pain, that heat, that temperature, it's going to react and remove yourself from the situation. So that's really the role of pain, and your brain then can process, okay, is this an immediate threat that I have to remove myself from, or is this something that I can kind of let it go for the moment?
Like mind over matter for that period of time.
Kind of, yeah. And so, of course, that also goes to people playing through pain, right?
Yeah.
Right? And so it's like, okay, I feel this kind of burning sensation or sharp pain when I'm playing, but it's okay. I'm just gonna power through it. I'm gonna get to the end of the piece, or I'm gonna finish my practice session, or I'm gonna just keep on going. So you can override that pain signal, very much so, but sometimes at a cost, right? whatever that consequence will be.
Right. And I'm sure along the way I've asked this question before, but for those who have not heard it, for those new to the show, for those who haven't seen an episode in a while, what amongst drummers and percussionists and drummers in particular who play drum kit setups, what's the most common injury and what's the most common cause? Is it overplay? Is it playing too hard, or is it poor ergonomics for their body type and the way they play?
That's a good question. So I would say that the most common injuries that I see in drummers would probably be tendonitis in the elbow. So either
Mhm.
golfers or tennis elbow, followed by shoulder pain, followed by wrist pain.
And are
Um, so
the last 2 more so from too much force
yeah, so the more
or too
common things,
much reach in the case of a shoulder? Sorry to interrupt, but
yeah, so
somewhat
with the
too much
yeah,
reach. Yeah.
with the shoulder, or sometimes they when they're riding up on the hi-hat, like they kind of ride up, like their shoulder also rides up too.
Yeah.
Um, so or with the wrist, oftentimes what I see is when I'll do it from the side so people can see. So like if they don't have a good setup, or their technique, and I'm not a drummer, so a lot of times I have to just ask people like, is this how you mean to, like, how you're intending to play, or is this like something that is necessary or not? Like, so I'm also like, I'm not just be like, oh, you need to do this. Like, it's definitely always a collaboration. But sometimes when
Yeah.
I see people when they're like, if their snare drum, let me think about this. If their snare drum is too high, then they're gonna have to bend their wrist a lot more, and you have a lot of tissues in this area, and so when you're doing this over and over and over again, then you could irritate and inflame kind of the structures in this area. So I see
Mm.
that a lot, and that is oftentimes stemmed from their setup, and even just adjusting things up or down, just like like not even a centimeter, like sometimes very, very subtly, can make a big difference in their mechanics.
Right. And the way they hold the stick, not only the way they hold the stick, but which grip they use. And for instance,
Yeah,
Todd Sucherman, who plays with sticks, I asked him once, how do you play with the snare drum like that high? How did you arrive at that? And because he plays traditional grip,
right,
like this,
exactly.
he comes down right on it. So it's perfect for him so that when he comes down and his ulna is parallel with the floor, basically
Right,
the stick, the drum's right there. Whereas just like you were
exactly.
saying, if he played mostly a match grip, then yeah, his hands more in that position, and over time, I can imagine the force would really affect that.
Yeah, and it's one of those things where I've had drummers even, come in with wrist pain, for example, and maybe they're like a working drummer. So like, they are gigging, 4 days out of the week or even more if they're touring, right?
Yeah.
And so they can't afford to stop playing. And so it's one of those things where maybe you find a way to, maybe they switch between different grip styles, to
Mm,
give their wrist a break in between, but still being able to play. Like if they're able to. Some people, like,
yeah,
they're only traditional. Some people are only match grip. So like,
yeah,
that kind of comes down to the decision making of the player, the artist themselves.
yeah,
But and I'm never one to be like, hey, you should consider doing this grip. Like, that's not really my place. But
yeah.
kind of looking and seeing like what other things could be potentially modified, or slightly altered to kind of help their physical issue at the time, and maybe they can go back to playing, with the same grip or however they want to play eventually. But in the
Yeah.
meantime, there might have to be some modifications along the way.
Very cool. I hope everybody's learning something. We don't have questions. I'm sure some people will think of some afterwards or when they see the archive of this in an hour from now or tomorrow or in a week or whatever. Um, and we always make sure Janice has the links to these so she can look at them on the other
Yep.
channels. Maybe check back, see if people have questions. And there's a way for you to get in touch with Janice right in the post, how you can follow her on her channels as well. Always very helpful stuff. Thanks, Janice, so much for always
Yeah.
sharing your
It's
wisdom
always
on this.
fun.
So yeah, it is. It's a very interesting topic to me personally, having been playing, I think 55 years now. I should be a lot better.
Whew.
Uh, but in 55 years, I haven't had that many drumming injuries either. So I'm
Yeah, knock on
pretty
wood.
lucky.
Knock on wood.
Yeah, absolutely. Coconut sound, insert coconut sound there. Thanks everybody so much for following what we do. So much more coming for the rest of the year. And thanks for joining Janice, Ying, and I here on Drumming Injury Talk. Not just drumming, but pretty much musical instrument playing injury talk on Drum Talk
That's
TV.
right.
Thanks everyone.
All right.